If you want to get rid of your glasses, it's important to understand that Lasik, Lenticule and ICL are three different procedures. Each one has its own advantages, and which procedure suits you the best depends on your eye health, power and lifestyle. Let's understand each procedure one by one. Lasik is one of the most popular and commonly performed laser surgeries to remove glasses. In normalized, light passes directly through the cornea to reach the retina, but if the shape of the cornea is not correct, light doesn't focus properly on the retina, and that's why glasses are needed. Lasik surgery reshapes the cornea so that light can reach the retina directly without the need of glasses. Lasik surgery is mainly performed in two ways: flap-based method and flapless method. Let's first discuss the flap-based method, in which a thin corneal flap is created, lifted, and then the cornea is reshaped with the laser. After that, the flap is placed back in its position. Now, this flap can be created in two ways: using a blade and using a femtosecond laser. The blade-based flap procedures include standard LASIK, C-LASIK and contour vision. When the flap is made using a blade, it can be irregular and complications such as incomplete flap, flap dislocation or buttonhole flap may occur. That's why nowadays making the flap with a femtosecond laser is considered safer and more precise. This same femto technology is used in CustomEyes Pro, where we combine customized personalized treatment feature with Zimmer femto lasers, low energy and high precision. The benefit is that flap-related complications are greatly reduced. However, generally speaking, flap-based procedures are now less preferred because once a flap is made, it never heals completely. If your eyes ever get rubbed or injured later, the flap may shift, leading to vision-threatening problem. In fact, we often see patients whose flap got displaced due to child's finger or a pencil hitting the eye. For this reason, at EyeMantra, we do not recommend flap-based procedures like standard LASIK, contour or wave light. Now let's move on to the flapless methods. In these procedures, laser directly reshapes the cornea. These are considered the safest form of LASIK, especially for people with thin cornea, those with active physical lifestyle or with pre-existing eye conditions. There are several types of flapless techniques. First is PRK or photorefractive keratectomy. This is the most basic flapless technique. In PRK, the outer layer of the cornea is removed using a chemical solution, and then the laser reshapes the cornea. Recovery is slower and achieving 100% vision may take 3 to 6 weeks. Second is topo-guided PRK. This is a modified version of PRK where, along with removing glasses, the cornea is polished for better clarity. This provides high-quality vision. Epicontura is also similar to topo-guided PRK, in which 22,000 points of the cornea are analyzed to remove aberrations for sharper vision. Next, coming to TransPRK, a one-step, touchless, bladeless and flapless procedure. The patient is positioned under the laser, and with just one press button, the entire treatment is completed in less than 5 minutes. Since no cut is made, it's extremely safe. Over 1 lakh points of the cornea are analyzed for aberration removal and polishing, resulting in supervision, which is better clarity and contrast than before. Next, coming to Smart Surf. It includes all features of TransPRK along with advanced ones like 7D tracking and dynamic cyclotorsion. During surgery, machine tracks every eye movement in real time for extreme precision, especially useful for patients with cylindrical power. All calculations from pentacam to data entry into the machine are fully automatic, eliminating human error. Lastly, in this category is CustomEyes with Foresight. Introduced in 2025, this is the latest and most advanced flapless procedure. It's an upgraded version of Smart Surf that uses AI-based ray tracing treatment planning. The software creates a 3D map of the eye, simulates results for every possible method, and selects the best treatment plan. This allows both doctor and patient to visualize post-surgery results in advance and choose the best approach, giving unmatched vision quality. Most patients achieve 6x6, 6x5, 6x4 or even 6x3 supervision. Compared to any other technology worldwide, CustomEyes provides a smoother corneal surface, maximum tissue saving and low energy laser pulses. This means that even if your cornea is thin or another doctor has denied you LASIK, CustomEyes might be still possible. It's also very effective for patients with high eye power because it's a touchless, bladeless, and uses AI planning. CustomEyes is currently the world's safest specs removal procedure. So if you have thin cornea, need maximum safety, or do a lot of physical work, flapless Lasik, specially customized or smart Surf is best for you. Now let's talk about the lenticule-based procedure. In lenticule-based procedure, femtosecond laser creates a small dish-shaped tissue called lenticule inside the cornea, which is then removed through a small tiny incision. This reshapes the cornea and improves vision. The most advanced and latest lenticule-based technology in the world is ClearNeo by Zimmer, a trusted FDA-approved Swiss laser system. EyeMantra is the only hospital in North India to introduce ClearNeo technology. ClearNeo is a new and advanced laser eye surgery superior to older lenticule-based procedure like Silk or Smile. It uses low-energy laser, only 2 to 4 nanojoules, and nano spot size precision, ensuring faster recovery and no pain. Each patient's energy settings are customized to the best vision clarity. The biggest advantage of ClearNeo is that it causes no dryness. Most patients see clearly the very next day and can resume their daily routines immediately. So if you have high eye power or suffer from dryness, then ClearNeo is the most advanced and reliable option. Now let's talk about ICL or implantable collamer lens. Lasik may not be suitable for everyone, especially for those with power more than -10 or very thin corneas. That's where ICL comes. ICL is an equally popular glass removal procedure where a custom-made lens designed as per your eye power is implanted inside the eye. No flap is made and the cornea is not reshaped. The procedure is reversible, meaning that the lens can be removed or replaced in the future if required. So ICL is best for people with thin cornea or very high power where LASIK is not possible. So choosing the right procedure for you. To decide the best specs removal option, you need to consider your corneal health, your eye power, your lifestyle, and your budget. If you want a budget-friendly option and have a slightly thin cornea, go for PRK or TransPRK. If you want high accuracy, fast recovery, and better clarity, choose AI-based CustomEyes or ClearNeo. If your eye power is very high, -10 or above, or your cornea is very thin, ICL is the best choice. Every procedure has its own benefit, but the final decision should always be made after consulting an experienced eye surgeon. If you also wish to get rid of your glasses but are confused about which procedure to choose, call our helpline today to book your free checkup. If you have any question or doubt, feel free to ask us in the comments.